It's infested, they may no longer have to miss school as a result. Tanya Rivera has more.
If you're a parent, then you know what a pain it can be when your child is stuck at home with head lice. But a new recommendation from the American Academy of Pediatrics may soon change all that. Dr. Susan Evans, Director of Dermatology at Skincare Physicians of Beverly Hills, is here with all the hairy details and some lice detection and prevention tips. Dr. Evans, great to see you again.
Good to see you always.
So how big of a problem is head lice?
You know, it's really prevalent. I mean, there's so many children that are affected, from 6 to 12 million a year that have head lice.
So it's not necessarily a growing problem, it's just always been a problem of a certain degree.
It has been a problem, and it's mainly transmitted from child to child with their sort of activities, but it's definitely prevalent. But the newer thing is we're managing it different, and the American Society of Pediatric is making different recommendations.
Absolutely. Let's talk about that, because it used to be if a child had head lice, they were sent home. Now the American Academy of Pediatrics is saying they don't need to be sent home.
Right, and so if you're a parent that have to ever deal with your school and how they treat you, if in the event your child had head lice and you definitely had to stay away, then it's probably like unbelievable to hear that that child can actually go to school. But what they found is the lice actually, by the time you see it, is already past the stage where it can really easily be transmitted. So why not let the child stay in school and learn? Why not let the parents go to work and earn that it's really not helping the situation to have them at home?
I love that. Very clear. Now, so let's break it down. Let's talk about lice. What does it look like, first of all? How do you identify it?
Well, you know, they're very tiny. They have 6 legs, and it's a bug. I mean, it's a gross looking thing. I mean, unless you like bugs, which I don't.
Yes.
And there's different phases. You can have the egg phase, where there's sort of attached to the base of the hair shaft.
And is that the contagious phase, the egg phase?
Yes, that's more so contagious, and that's when they're called nits. And this is the whole term nitpicking.
Yes.
Like if you're a nitpicker, because you actually have to get the nits off. They're very difficult to do. You need a fine-tooth comb, and we'll talk about that a little later, but this is the different stages that they go through.
Now, once you actually have full-blown lice in your head, adult lice, is it very, very itchy?
Well, it's irritating. I mean, clearly, this is a parasite.
Right.
It lives on the hair, and it feeds off of the scalp. So you're definitely going to feel something in there.
Now, if your children have longer hair, are they more susceptible to getting lice, or the length of the hair has nothing to do with it?
You know, it has nothing to do with it, because the actual parasites love the scalp, and they like to be right near the hair shaft.
And how do you get it? I mean, do kids have to rub their heads up next to each other, or is it enough to share a hat?
It's an excellent question. You know, they're at like slumber parties, and they just do a lot of head-to-head activities. The girls are playing in each other's head. They're very close. Their proximity to each other is a little different than adult spacing, and they just get it from contact.
Can it be transferred through brushes?
Definitely. It can. It definitely can, and clothes and coats and, you know, all their sort of things that they carry around.
So it is fairly easy to spread.
It is easy to spread.
Now, you have some tips on how we should examine our heads and properly check out whether or not we have
Exactly, because the way you're
lice.
going to find it on your children or yourself is actually to look, and I want to give you an idea of how you do it, how simple it is, and what you're looking for.
Let's go see our intern Kara over here. She's going to help us out with that.
This excellent Kara, who has beautiful hair, by the way, and she's here to show us willingly what we would do to look for lice.
Right.
And I've parted this area here, and this is exactly what you're doing. You're parting so you can see the hair roots as well as the scalp, and you're going to section it off several times. This is a fine-tooth comb. There's special combs that are made just to remove it. You can wet the hair if the lice is there to actually pull the lice out.
So is that all you need, a special comb to remove it, or do you also need medicated shampoo?
Well, it's controversial, because previously we use actually like a pesticide, and you know, this is a common thing. It happens to good people. You know, you could be clean and actually get this, and people were feeling very concerned about putting pesticides in their children's hair. Why do that?
So how do you recommend
there's actually lice fairies, and there's locations that you can take your child to, make it a very pleasant experience. They give the kids Nintendos or something activity. They wet the hair and they pull it through and they get it out, and they'll use other topical things that are not like chemicals and toxic to the kids.
And important to remember, this is no longer linked to poor hygiene.
It's never been hygiene. It's just, these are parasites that are opportunistic, and what happens is kids give them plenty of opportunities.
Right. So that's what we love. That's what we love about our kids. They're active and they share, right?
They do.
All right, Dr. Susan Evans, thank you so much for all this very important information. And don't forget, you can follow ABC News Now on Facebook and Twitter. Just search ABC News Now.